This is from the Imperial College COVID-19 response team. They're the ones who've been advising the government on this, as I say, and they say that we are in for the long haul here. They're talking about how they have changed their minds in the last few days based on what is happening in Italy. They also say demand here early in the outbreak is proving to be twice as high on hospitals than they had been anticipating, with a high number of patients being admitted to intensive care and a high proportion of those dying. So they have redone the maths. They are looking again at what is likely to happen here in the UK. And I have to tell you, Colin, that they are talking about, even with the kind of measures that we're hearing about today, that they're predicting that they might reduce the peak critical care demand by 2/3 and half the number of deaths. But even with this optimal mitigation scenario, you're still looking at an 8-fold higher peak demand on critical care beds over and above the available surge capacity in the UK. They're talking that even in the most favourable scenario, there would be in the order of 250,000 deaths in the UK based on that strategy.
I'm very, very concerned that we see a rapid spread of this disease, and it is time to take more dramatic measures.
The city that never sleeps is shutting down over the coronavirus. New York City will close its bars and restaurants to limit the spread, meaning takeout and delivery only. And the city's mayor, Bill de Blasio, added the nation's largest school system, with over 1 million students, to the list of those suspending classes.
It's important for the young and healthy people to understand that while they may experience milder symptoms, they can easily spread this virus, and they will spread it indeed, putting countless others in harm's way. We especially worry about our senior citizens. The White House Task Force meets every day and continually updates guidelines based on the fast evolving situation.
Scientists work to contain the coronavirus. Researchers are still trying to figure out where it came from. Early research suggests humans picked up the coronavirus from animals, possibly bats, but it's not clear how the virus made that jump.
The stock market took another hit today. Is the U.S. economy heading into a recession?
Well, it may be. We're not thinking in terms of recession. We're thinking in terms of the virus. Once we stop, I think there's a tremendous pent-up demand, both in terms of the stock market and in terms of the economy. And once this goes away, once it goes through and we're done with it, I think you're going to see a tremendous surge.
That was given, the first injections for the first person took place today. You might recall when we first started, I said it would be 2 to 3 months, and if we did that, that would be the fastest we've ever gone from obtaining the sequence to being able to do a phase 1 trial. This has been now 65 days, which I believe is the record. What it is, it's a trial of 45 normal individuals between the ages of 18 and 55. The trial is taking place in Seattle. There will be 2 injections, one at 0 day, first one, then 28 days. There will be 3 separate doses, 25 milligrams, 100 milligrams, 250 milligrams, and the individuals will be followed for 1 year, both for safety and whether it induces the kind of response that we predict would be protected.
Moments ago, Ohio Governor Mike DeWine announced that he is canceling in-person voting tomorrow because of the outbreak, tweeting, quote, "We cannot tell people to stay inside, but also tell them to go out and vote."
Within the last few minutes, the French President Emmanuel Macron has announced that France and most European Union partners will close their borders to non-European countries for 30 days from tomorrow at noon. At the same time, the movement of French citizens will be strictly curtailed for at least 15 days. Only essential travel will now be allowed in France, with infringements sanctioned.
고개 좀 위로 하세요. 소리 크게 해보세요.
Stop with you. And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it a 10. I think we've done a great job. And it started with the fact that we kept a very highly infected country, despite all of even the professionals saying, no, it's too early to do that. We were very, very early with respect to China. And we would have a whole different situation in this country if we didn't do that.
One term you are likely hearing a lot about to help deal with the coronavirus is what is known as flattening the curve. Epidemiologists say if not enough protective measures are taken, there will be a sharply rising number of cases, as shown in this pale blue spike. A huge jump over a very short period of time. That would strain the capacity of our health system. But flattening the curve, reflected by the lower gray swell, is achieved by taking strong measures like physical and social distancing.
Airlines said it would halt all operations from Wednesday night. Britain's Virgin Atlantic said it would ground 85% of its fleet. Europe's biggest budget airline, Ryanair, warned it could ground its entire fleet. IAG, owner of British Airways and Iberia, said it would cut capacity by 75%. The full list of moves is much, much longer. For airlines, the outlook darkened again after Spain declared a state of emergency and the US extended travel curbs to Britain and Ireland.
The market was in a free fall, the Dow losing down almost 3,000 points. I missed the percentage. I think about 13% loss. There's the S&P down 324, NASDAQ down 970.
Nightclubs, gyms, and fitness centers and classes will also close entirely, effective at 8 p.m. this evening, until such time that it is deemed safe for their reopening. Again, I repeat, casinos, racetracks, movie theaters, performing arts centers, nightclubs, gyms, and fitness centers and classes, all will close entirely, effective 8 p.m. tonight, until such time that it is deemed safe for their reopening.
Have things improved in Lombardy?
No, things are just as bad as last week. So every day we struggle to find enough beds for our patients, and the number of patients keeps increasing. We have treated in total in our ICUs 1,300 patients right now, and almost 1,000 of them are currently being treated in the ICU. So it's a continuous increase in the number of patients. But this was...
It seems to me that if we do a really good job, we'll not only hold the death down to a level that is much lower than the other way, had we not done a good job. But people are talking about July, August, something like that. So it could be right in that period of time where I say it washes through. Other people don't like that term, but where it washes through.
Is this the new normal until the height of the summer?
We'll see what happens.
Right now, because the stock market just opened and it just closed. Within 30 seconds, the Dow had dropped and the S&P 500 had dropped below their trading limit that sets off a freeze, a suspension in trading in the market. You see it right there, nearly a 10% drop in the Dow in the first minute of trading this Monday morning. Of course, it comes as the coronavirus crisis continued to spread around the globe overnight, now nearly in 150 countries around the world, 49 states, plus the District of Columbia. There was an emergency rate cut by the Federal Reserve on Sunday night, but that did not do the trick in the markets this morning.
Hancock, the health secretary, saying there are now 53 deaths caused by coronavirus in this country. That's up from 35. Let's have a listen to what the health secretary had to say.
Mr. Speaker, the coronavirus pandemic is the most serious public health emergency that our nation has faced for a generation. Our goal is to protect life.
We'll always consider the safety and the security of British nationals. So with immediate effect, I've taken the decision to advise British nationals against non-essential travel globally for an initial period of 30 days and, of course, subject to ongoing review.
We've made the decision to further toughen the guidelines and blunt the infection now. We'd much rather be ahead of the curve than behind it, and that's what we are. Therefore, my administration is recommending that all Americans, including the young and healthy, work to engage in schooling from home when possible, avoid gathering in groups of more than 10 people, avoid discretionary travel, and avoid eating and drinking at bars, restaurants, and public food courts.
The death toll climbs every day by a little more, and so does the urgency around the question, how bad can it get? We've seen a leaked document warning that NHS staff that up to 80% of the population could be infected in the next 12 months, meaning up to 7.9 million people might need hospitalization. And even if we ramp up our hospital bed, nursing and ventilator capacity dramatically, how can the system cope?
Health checks on air travellers are getting ever stricter. At Beijing Capital International Airport, all arrivals from overseas will now have to spend 14 days at a nearby quarantine facility. But every day there are fewer international passengers to deal with. As the coronavirus crisis deepens, airlines around the world are taking drastic steps.
The coronavirus pandemic is the worst public health crisis for a generation. It is unsettling for families up and down the country and in all of our constituencies. So we need a united effort to tackle COVID-19 effectively and to come through this challenge, as I'm confident that we can and will. Mr. Speaker, UK travel